Good afternoon. Welcome to In Focus, Racism and Housing Access. I'm Elizabeth Dunbar, Assistant Program Director at NPR News. NPR News and Catholic Charities of St. Paul and Minneapolis are partnering on this virtual event to raise awareness of Minnesota's persistent racial disparities in housing. You might be watching this on Zoom, or maybe you found us through Facebook. We're streaming live on both the NPR News and Catholic Charities Facebook pages. However you're joining us today, I want you to pause for a moment and think about where you're joining us from. If you're at home, think about how long you've lived there. Who lived there 10 years ago, 50 years ago, 200 years ago? Think about the land your home is on. I want to acknowledge that we are on Indigenous land and to acknowledge that Indigenous people are still here and they're thriving. So to the first people of this land that we call home, thank you. We're also aware of the COVID-19 pandemic and how it has forced many of us to redefine and reconfigure our homes to make room for more activities and perhaps more people. The pandemic is also exacerbating some of the racial disparities that we'll be talking about today. And before I introduce reporter Peter Cox in our panel, I want to mention a couple of things that will help you get the most out of this event and also keep events like this going. So at the bottom of your screen, you'll see the Q&A button where you can submit a question or a comment. We'll get to as many of those as we can, but please know that we hope this event will spark further conversations and reporting on housing issues in Minnesota. And we can't do that without your help. We're in the midst of our fall member drive, and if you've already contributed, thank you. If you haven't and would like to, you can visit nprnews.org/donate. Peter Cox will lead our discussion today. He covers aging issues for NPR News, and his reporting over the past several months has focused on the pandemic. Peter?
Thank you, Elizabeth. And thank you all for joining us today. Racism, however blatant or subtle, has long played a role in access to housing across the country and across the state. Minnesota's racial disparities are consistently among the widest in the country, in education, in income, in employment, and in housing. For instance, while home ownership among white Minnesotans is around 77% in the state, home ownership among Black Minnesotans is at 24%. That's one of the largest gaps in the country. Black and Indigenous adults are overrepresented in the state's unsheltered population, and Black women are also overrepresented in evictions nationwide. So what accounts for these huge inequities? What obstacles do those facing homelessness, do tenants, do prospective homeowners face? And which solutions are showing promise in Minnesota and which are not living up to those expectations? This hour, we'll try to answer some of those questions with a distinguished panel of guests who come at these questions from both personal and professional experience. Dr. Mai-Kao Hong is Vice President of Strategic Initiatives and the founding dean of the Morrison College of Health at the University of St. Thomas. She's the former CEO of the Wilder Foundation and has served in several other capacities dealing with affordable housing. Thanks for joining us. Sam Strong is the Tribal Secretary for the Red Lake Nation, where he has also served as Director for Economic Development and Planning. He's been involved with a new housing development in Minneapolis that's expected to open soon. Welcome, Sam.
Bonjour.
Now, before we get to questions, there are a couple of other people we'd like to hear from, so we're going to start with a video of their conversation. We wanted to hear directly from people facing and working to prevent housing instability. So sit back for about 5 minutes while we hear from DeAndre Gordon and Venice Gerald.
When you think about like racism and housing access, so like someone's ability to secure, safe, affordable, quality housing, how do you see like racism like showing up in that way?
I see racism in the aspect of fence-lined neighborhoods and tree-lined homesteads, where you're not welcome with a sign that says, hello, such and such lives here. We have not met you, but we'll be happy to meet you, although we have not as yet met. Instead, you see a trespassing sign. You see the signs of guns posted. You see the signs that says there's a dog on board. You see all kinds of signs that let you know and remind you that you are not welcome in these parts. So racism again is defined by what areas are we truly able to explore, to discover. Racism is structural within the grassroots of every institution in America.
Help us understand like why transitional housing like is important, and how that can benefit someone who's seeking to move into more permanent housing, something that they can call their own and something that they have the rights over.
What Maslow theory emphasized is that human motivation begins and ends with housing. And so many people have not been able to even reach the third layer of Maslow theory, which is the psychological needs. Many of us are able to live and surface on the lowest level of our basic needs. And many of us in this life will probably never even get to the apex of the theory, which is self-actualization. Human lives and the conditions of human lives must be advocated for through public policies.
Because if the public policy is not there, then there's not much of an incentive to bring about equitable housing.
Yes, because most people think of public policy as the cry for help. They think of public policy as a public appeal. Public policy is the perfect medium of all exchange. In all negativisms and positivisms of all realities, the human condition is the cry for help. The human condition is the appeal for the public. And public policy is the perfect medium to bridge the gap.
I would love to see, the state of Minnesota move in the direction where we stop politicizing human life, human values. Like I'd like to see public policy focused on being human-centered. So instead of asking questions like, how much does it cost? We ask questions like, what do people need? What do people need? That's really what it comes down to. And when we ask that question and we hear the answers from disenfranchised folks, like you mentioned, we don't argue with people's experiences. We take their experiences and we turn them into public policy that actually centers on their voices. Because none of us should say, we could never be homeless or never, end up in bad situations. Because at the end of the day, much, COVID-19, has shed, glaring light on that is you, me, anybody could lose their job and now they're in a precarious position of whether or not they'll be able to keep their housing. And if they can't keep their housing, then it's a spiral down from there.
So we heard there from DeAndre Gordon and Venice Gerald, and they're really urging us to think seriously about policies that could address disparities. Mike Howe, I wondered how critical this issue is right now, especially during the pandemic.
Yeah, so this is a really critical issue right now during the pandemic. And I actually like to talk about the dual pandemics of racism and also the pandemic of just COVID that we're living in right now. So racism over time, our brand of it in the United States has been built over centuries. And it's really important to understand that some of the foundational work that we're doing to address poverty, address health disparities, to really address housing issues were built up over a very long time period in terms of intergenerational impacts that were social, economic, historical, and political. And that those really fell along the formation of a racial hierarchy that devalues certain human lives and actually lifts others up. So a lot of people have a hard time connecting our historical policies with policymaking that we're right now. So my doctorate's in public administration, and I actually study white anti-racist allies. So I am studying people who, though of the dominant culture or majority, racial majority, have actually taken it upon themselves to advance racial equity, either in government or with policy, and through actually organizational actions. Because people of color in this country, particularly Black people and Native American populations, have not had access to the types of power that are in Congress or with our legislative bodies and or with making housing policy. So I think I call this the reckoning in America of these two really pandemics that have been in the making for a very long time. And so what we see along the fault lines with homelessness, affordable housing, and what's actually happening with infection rates is that you see poor populations unable to access testing. You see populations of color who are living in certain neighborhoods not having the type of response that they really need to. So it's not really a revelation in America. This is really the reckoning that I think many of us who've been working in the community and addressing health disparities, housing disparities, disparities in education have known that have existed. And I think our current climate is really revealing that to a broader population that might have kind of in their minds knew that this might be an issue, but really weren't experiencing it. Now we're all experiencing it.
Yeah, it's become much clearer. Sam, I wondered if you can talk about how you've seen race and discrimination play out in housing access across Minnesota.
Definitely. Yeah. I mean, for me, there's a lot of different layers to this. Native Americans live in many different kinds of housing situations. You have the urban members. About half of our membership live in the metro area of Minneapolis and St. Paul. And so they're faced with a whole set of issues. And then you see the more rural off-reservation housing issues. Many of our members face that. And you have the on-reservation housing issues. And so each layer, if you will, has its own set of issues, all centered around a lack of access to housing. Many of the issues that create that vary from you talk about the historical trauma, the lack of access to services, but also more importantly, I think for Native people, we have a lack of trust in the system. The system has oppressed us for generations and generations. And, my father was part of the relocation era. And so back in the 60s, 50s and 60s, they were dumping natives all over the country with no resources. And in fact, the intention of this program was to eliminate Native people. It was a termination policy of the federal government. And so, our lack of trust within the systems that are supposed to help us is immense. we very much don't trust the people that are supposed to help us, and many times the people that are placed there to help us oftentimes don't have our best interest in mind. And so we see that across the board. We see that on reservation, we have over 500 people on the waiting list for housing. This is a situation where we just don't have housing. So literally we have 2 and 3 generations stacked up in a single house, and really deplorable housing conditions. And so we're seeing that now with COVID. It's a very dangerous place to be when you have no place to isolate, if someone within a home gets sick, et cetera, et cetera. And then off the reservation, in the rural areas, there's a significant amount of racism when it comes to just getting a lease in any kind of housing. There's sadly a very strong anti-Native sentiment in all the communities surrounding the reservation. There's a lot of both overt and covert racism that we experience, everything from the social services being very inadequately provided to help place people into housing, as well as the actual owners of housing being very finding ways within the legal system to prevent Natives from being housed in their units. And so, and then you go down to the Twin Cities, and sadly, Natives are amongst the worst when it comes to the housing disparities. And those really exist out of a combination of all those factors. You do have the tenants that, experience the racism from, not being able to find a home because of, the housing policy of that particular landlord. You have a severe distrust in the system, and then really a lack of access to resources. We don't have the same housing advocacy groups that many others have. And so it's very much it's a combination of factors that necessarily don't, each person has their own situation.
Right.
The sad truth is that really for all of our people on the reservation, close to the reservation, as well as in the metro areas, we're very much having to go through the struggles of dealing with this. And I'll share one more thing before we move on, is that, these people want to be housed. They want to live a better life. And we really see housing as the piece of the puzzle that allows our people to overcome the historical trauma and all of the hardships that we face. And, when we did some work on the wall of Forgotten Natives. And, when we started that project, we were, concerned, why aren't these people, we're going to get them housed into long-term housing, right? And so we provided the supportive services, and many people told us that we're going to fail because these people just don't want to live in a house. They're not capable of doing the work that they need to really have sustainable housing for themselves. And so in fact, people with a whole slew of issues, from mental health to chemical dependency issues, these people are still being housed in the same housing we place them in. And so we're seeing, an upwards of 70% success within this population. And so I think that shows that if you give them culturally relevant supportive services, as well as break down the barriers and find the landlords that are willing to accept these tenants, that it can work. But without these supportive services, and without like the culturally relevant and services that people can trust in, we're going to sadly continue to see those disparities.
Mike, how I read an interview from a few years ago you did with my colleague Laura Ewan, and it was about how your own experience with housing growing up kind of shaped the work you've done. But I wondered if you might just talk a little bit about what you faced growing up in the Twin Cities.
Yeah, so I was born in the country of Laos, and I, along with many other Hmong refugees, was resettled after living in a refugee camp where you are really, it's hard to describe what a homelessness situation in in a neutral country where you're a refugee is like slept for a year in a refugee camp with just barely shelter being available, and then came to the Midwest and came to St. Paul when I was 6. But we were one of those refugee families that were doubled up in the public housing because we didn't really know anybody. And so when you're a refugee family and you get resettled, usually you know nobody in the world. We were known as a free case back then, which basically means in all of America, there was not one person who had a personal connection with us. So the love of strangers really welcomed us into this country. But I was homeless for quite a long time while we were waiting to apply for public housing, and wasn't treated very well necessarily by the family that we were living with at the time, because they also didn't want us there. But I remember well the stigma of being homeless myself as a kid, still needing to go to school, still trying to accomplish something, learning a different language, and both my parents actually trying really hard to find work. Their English wasn't great at the time, so it took a while, but we eventually did get into public housing and did find jobs and did fine. But I think even as an adult, as an Asian American person in the Twin Cities, having experienced housing discrimination as a homeowner and as someone who's trying to build a home or actually just go somewhere, when I tell these stories about how I, as a professional, often get turned away from goods and services, my friends who aren't people of color just can't believe the indignities that I live with. But I have been, like one time I was driving back from Montana, and halfway back, we decided with our 4 kids that we really needed to go to a hotel, and we went to Holiday Inn. There was a big vacancy sign, many rooms to rent. When my husband went in there with my brother-in-law, we were actually turned away. The manager basically said that there were no more rooms to rent for that night, and it was like 2 a.m. in the morning with 4 small children. So then we had to actually go and find a different hotel across town, more cheaply priced, and they let us in. Now, we noticed that there was a Chinese restaurant that was connected to the hotel. But I tell that story to say, racism, discrimination, and bias is real. I've experienced it with even today of looking for homes. There's the individual behavior that how people treat you, and then there's structural pieces. But often the structure enables the individual behavior to continue. And so I never take anything in my life for granted. I think that when people are experiencing housing instability or bouts of homelessness, or are even long-term homeless, there are often issues in their lives that have, there are other things that are going on, and they can't get the support services they need. For example, having previously been the president of the Wilder Foundation and really looking at the results from the triennial homelessness study, over 50% of the people who are on the streets and experiencing homelessness have some physical health or mental health issues, and they're just simply going unaddressed. Now, when this happens to families, of which my family was one, and you can't get up and going, usually it takes about 18 to 24 months. A lot of the research, a lot of studies from across the country takes about 18 to 24 months. So about 2 years for someone to get reemployed, to get a certificate, to get out of a domestic abuse shelter and into transitional housing. So we know what solutions actually can work. We know that culturally relevant and responsive housing supports can assist people. So I grew up with a life that was more challenging than many people, and not as challenging as some that I've ended up serving over my career. But usually when we look down on people because of what they have or don't have in any situation or circumstance, we don't see those individuals or families as people with potential. And that's the problem. There's a lot of stigma around being Black, Native American, Asian, poor. And so all of these stacked up stigmas and the discrimination over time does create trauma. And it also creates like situations where people and families, no matter how hard they work, can't make ends meet. So I always think about like housing policy and access as really, really smart economic development because we need people to be healthy in order to work, and we need all of our people to actually be safe and have decent housing.
Right. I want to play some tape here. This is a person who's going through an experience like this. This is Tamika Neal, and she works at Catholic Charities Northside Child Development Center and lives in North Minneapolis. And just a few weeks ago, she found out that her rent is going up, and she's looking for a new place in the area, but is struggling to even get a showing. She's running into housing barriers that she says feel discriminatory.
This is a predominantly Black neighborhood. I can't help but take it that way. Like a lot of these people, a lot of local businesses are closed down right now. A lot of these people don't have jobs. So when you're asking for 3 times the income, you clearly, that's not going to benefit any of these families here. So who are you looking to move here? Where are they going to go? It's cold outside. Like y'all dropped this on me like right after a snowstorm. And I'm literally like, I couldn't even wrap my mind around it. Like you're raising the rent and you just telling me this, like, it's not you, it's me. Like, that's not empathy. That's not sympathy. Like, you don't understand what I'm going to. You get to go to your home wherever it is. I'm the one that got to struggle. I have 2 kids. We've been homeless for like consistently the past 3-4 years. And so it's very frustrating. It's hard.
I just wonder if either you might just talk about kind of what this does to a person to have this instability in their lives. Mike,
I can go.
Just waiting for Sam to say something because I just answered. Sam, I think you could respond and then I could say a few things.
Yeah, for sure. And, for us, what we found is that, housing is really the tip of the iceberg, right? And without housing, you're really limited in the ability to work with these individuals, without, and it's more than housing, it's,
right.
They always say, food, shelter, and clothing, right? And for us, without housing, we're not able to start dealing with the mental health issues, the generational trauma that many of our people are faced with. And, it's one of those deals where it limits the ability for these individuals to not only better their own lives, but to better their children's lives. And so we see this generational trauma continuing to be perpetuated within these households. And it's really, it's discouraging. It's discouraging to see that, to hear those stories of people that have stability and for whatever reason, may it be a landlord increasing rents, some kind of legal issue that may have arisen, or some kind of chemical substance abuse issue. You see people really starting to fall down that slippery slope, and it begins with the housing, their housing being impacted. And once that happens, you just see their lives and their families' lives going in a very negative direction. And so it's very much something real that our people are faced with on a daily basis. And the same can be said when you start to solve those housing problems. You'll see that they're not necessarily immediately getting off drugs and dealing with their mental health issues, but they start on that road. And for many of these people, that road takes years, and their recovery takes years. And so instead of saying, hey, you got to be sober, you got to just immediately deal with all these mental health issues, you got to deal with all your legal issues, we say, hey, let's get you into housing. Let's work with people on getting rid of some of the legal issues that may have prevented you from getting housing. Let's find a group of landlords that are willing to work with people with more questionable legal backgrounds. And let's set this all up ahead of time, because going to a house and or an apartment complex and getting rejected for many people, that's the end of it. You know, having one instance of failure in an already stressed out situation can push someone over the edge. And sadly, you know, we're seeing that right now at an unprecedented level. You know, you see, you know, for a lot of our people, the first step to you know, instability is losing their income and getting their power turned off, and then becoming evicted. You know, that's the kind of the process that we see happening. And once that happens, you know, you can lose this individual for years. They can get lost within the system, if you will. And it's really unfortunate, but at the same time, once you give them those same resources and a path to it, you see great success. And once these people are outside of the social service system that we have here in America, you're actually going to be saving the municipalities, the organizations, incredible dollars just by placing these people, having them working jobs, and not being sent to the emergency room, not you know, not all the cost to society that sadly are brought upon by homelessness and drug addiction and all the social ills that come with homelessness. And so, you know, to me, it's a simple solution. If we want our society to prosper, we have to invest into our people. And once we do that, that investment will be realized immediately. And so it kind of begs the question, why aren't we doing that? And it comes back to that systemic racism. And you know, the leaders that lead our country are willing to give into that negative stigma of homelessness and say, hey, these people are worthless. They're not, you know, they're not capable of functioning in society. And that's the exact opposite of the truth. And it's the exact opposite of what's best for all of the people. These stigmas, this racism, it's holding back all of us. And it's costing us all a lot of money. And so it's really, it comes back to, why are we doing this? You know, it's that inherent racism that's really strong.
So, you know, without the stability or the anchor of a house, you really cannot deal with other issues in your life if that main core of living is not there.
Yeah.
100% across
Yep.
the board.
Yeah, it is. I mean, everybody needs a stable foundation and a place to call home. Whether that home is even on a temporary basis, you know, transitional housing, or, you know, for people who are dealing with chronic health and disability issues, permanent supportive housing, where you're going to get the right level of supports to stay off the streets and to still live a decent life. But health, housing, and economic issues are really tied together. And the other thing that I think a lot about in terms of the health dimension is that we're social creatures. We're human beings. I think if people didn't really get that before, they do now with all the COVID. People want to be in groups. You know, people want to be relating to each other, but we can't be social and emotionally well with our mental health if we don't have a stable place. And we can't build a strong foundation with learning and living and working if that's also not the case. So housing instability and a spout of a duration or an episode of homelessness or struggling with affordable housing is really very detrimental, not just to adults, but to children particularly, because they are still going to need to go to school and do things. Sadly, in the state of Minnesota, what we are the most short of is family housing, affordable family housing. So just to give you an idea of who's actually on the street as of 2018, when we just last did this homelessness study that was statewide, on the single night count that we did at Wilder, deploying 1,000 some volunteers across the state, we still found that half the people who don't have a place to call home are under the age of 24. Huh. Yep. That's to me, that's a lot of wasted human potential in terms of what could be. And because we have two strong demographics happening in the state of Minnesota, we have a strong aging demographic that's white, and we have a strong young dynamic, good for Minnesota and economic production, that really is kids of color and families of color. So we're actually behind the rest of the nation in terms of this demographic change, with younger people or I would say younger Americans like myself and my kids having more children. It's not a good dynamic for Minnesota. It's not a good economic strategy. It's not a good stability strategy, and it's not a great health strategy if you really think about it. So we're on both ends of the spectrum. We're going to cross over at some point, and you can see that those disparities during COVID and this time that we're living in really being replayed over and over. So it's not really just about individual behavior or a discriminatory act here or there. We actually need targeted policies that support families and kids, and we need like stronger subsidies to help prevent people and families in particular from falling down that negative cycle that Sam's talking about for too long. Because if you do that for too long, you think about like a 5-year-old, a stint of 3 years or 5 years is really a lifetime, so a lifetime of falling behind on the achievement gap, of wasted human potential to actually contribute to the state of Minnesota. So when we strengthen home ownership and actually many housing solutions, we really strengthen Minnesota, and we actually promote good health and good mental health, because we need that foundation. And every family is like that. It's not like it's race agnostic, I say. It's not, whether you're a white person, a Native person, a Black person, or an Asian person, you need that as the cornerstone. You need a place to call home, to belong.
I'm going to start turning to, we have some questions coming in from our audience. This comes from Mary. She says she works with men and women who have criminal convictions. In Minneapolis, landlords may not turn down a potential renter if a felony conviction is older than 7 years, but that's still a long time, and many people of color are disproportionately represented in the criminal justice system. How do we encourage landlords to rent to people with felony convictions? Could government offer incentives?
Well, they in fact do offer incentives to rent to these individuals, and we do offer these programs. The problem is just more so, I think, I would say, in people's prejudice or their preconceived notions about working with these populations. And for us, that's what it comes down to, is we have to find the landlords that have their heart in the right place. And financially, it can be a beneficial situation for the landlords to have these sustainable forms of rent subsidies coming in. And so I do think we can provide more incentives. Clearly the program isn't working as well as it could. What we've ended up doing is just going out and trying to find good landlords, and so these are the partners that we create for our housing solutions. And the reality is we just need more of that too, more of housing advocacy for these populations, and setting up these systems that allow these people to succeed rather than to fail. And like I said earlier, these people have been turned away left and right. The government bureaucracy that we have has created a great sense of distrust. And so, somebody trying to work in a system without these advocates and without these, systems that are culturally relevant and led by people that they can with empathy, with our workers, they care about our people. They're working in these housing support capacity because they care. And so that's a huge untold factor in success, is finding people that really care and that want to make a difference. And that's the same statement I would put out to people that are landlords right now. It's like, hey, do you care about solving this problem? And if you do, come to the table and be one of these housing providers that are willing to take a risk. And really, it's not a financial risk, but it's a risk in the sense that you're doing something that's outside of your comfort zone. In fact, financially, it can be very beneficial to these landlords. But it's more so, it's like this internal perception. And to be honest, as much as I've wanted to help the same population, I didn't expect that level of success from that homeless population on the wall. You know,
Yeah.
I myself, this open-minded, you know, a lot of these people are my family members and part of our community. And, you know, even myself, I had my preconceived notions. I was like, hey, if we get 1 out of 4 people, 25% into stable long-term housing, that's a great success, you know. And I gave into a lot of these same perceptions. And so that same conversation needs to be had across the board. And each individual, you know, that's what it comes down to, is an ability for these people to open up their heart and see that this is an opportunity for them to be a small part of the solution. You know, it's got to come down to that individual level. And we got to change the perception that these people are not housable, that they're going to destroy the properties, and that they're not going to have long-term success. And we got to change that. And I did want to make one comment about the criminal justice system. You know, our people are far and beyond the most affected by the criminal justice system. And so it's you know, it's very much a huge part of this puzzle. And the flip side of that is that we're putting homeless people into jails and prisons because they're homeless. And what kind of sense does that make? You know, do you know how much the state and the federal government is spending on housing these homeless people in jails? It's just totally ludicrous when you look at the financial impact to our society. You know, and it comes back to, why do we do that? It's that internalized oppression that we all believe in. How many people walk by homeless people and say, you know what, you caused this, you're the problem, and there's no solution? You know, if you took a poll of people, you would see that 8 out of 10 people believe that. They believe that these people have created their own problems. They don't understand the concept of, you know, generational trauma. They don't understand that for Native people, the federal government took us from reservations and dumped us into cities. You know, they don't understand that when, you know, when these Native people are coming out of these, you know, non-urban communities, you know, they didn't even know how to cross the street. You know, I talked to my father about some of the things that some of his friends were dealing with. They didn't know how to wash clothes. They didn't know how to cross streets. I mean, just simple things.
Yeah.
And there was no tools for success. And you see that generational trauma continuing today. And so, you know, for me, it's, is it what's in your heart, you know, what's in your mind? And for me, I had to confront my own reality, that even being the person that has spent, you know, a good majority of his life trying to solve these inequities, I myself had to change the way I perceive my own people. And I think each one of us needs to come to that realization that these people are great assets. They can succeed, but we have to give them that chance. And when we do, it will work.
I wonder how, you know, history has played a role in the disparities of today, as you pointed out, Sam, with, you know, putting people all over, redlining, you know, in covenants in Minneapolis. How have those things played a role in what we see today?
Well, you know, for me, it's like looking at the history of how the federal government has tried to terminate Native Americans. You know, it began with, you know, the boarding schools. My grandmother was in a boarding school, and they would beat her for speaking her own language. There was rampant molestation and you know, significant trauma that occurred to a whole generation of our people, my grandmother's generation, in fact. You know, and you take it to the next level, you know, and then you talk about the, you know, what my dad had to go through. You know, they shipped off all these natives to urban areas with the purpose of having them fail, you know, with the purpose of creating disparity and creating homelessness. You know, and so you look at these historical traumas that have happened, and it's no wonder that our people are dealing with mental health issues. They're dealing with chemical dependency issues. And you know, the thing that really bothers me is now you see the criminal justice system being this oppressive tool. And you see our people not only getting into the system, but staying in the system. You know, recidivism rates are incredibly high within the Native American population. And it prevents us from working, it prevents us from having homes, and it prevents us from raising our children. And so, you know, they talk about, you know, the connection between, you know, the ghettos and mass incarceration as being, you know, the fourth institution of slavery. And for, you know, Native Americans, we never had to deal with slavery. However, now we're dealing with this institution of mass incarceration and the connection to our people. And there's no doubt that the trauma that occurs when you take a father out of a home to that child is profound. There's no doubt that when you have a legal record, you're going to have incredible difficulties living a meaningful life within the confines of our government. And so, yes, we've been, you know, redlined and greenlined, and you know, lack of adequate education, lack of adequate healthcare across the board. But to me, it's that, you know, the generational trauma, the boarding schools, you know, the sending our people all over the United States without resources, and the, you know, relationship between incarceration and our communities. It's profound. It's extremely profound.
Yeah, I think I would say, you know, I think we can talk about redlining and zoning ordinances and steering with real estate agents to certain neighborhoods. I think happens to homeowners, people who are seeking their first home. I think there are also some safety things that occur when you're a person of color, families. You might not just be, you might be steered towards neighborhoods that are less safe with whether you're renting or whether you're trying to own a home. There's also, you know, one of the things that we don't think a lot about, you know, with policy or actually, you know, this would be true for the private sector as well, is just benign neglect. In other words, you know, through no intentions whatsoever, focusing on populations that we think are more worthy and just leaving other populations behind. I mean, that's actually a lot of the how health disparities have happened. Oh, it's not that I was denying you access, it's just that I didn't see you. Oh, and I can't really see you. So you don't really have access because there's this secondary bias that's happening through no ill intent, but no value for those types of lives in that particular neighborhood, other than maybe, you know, situations that like George Floyd's murder, where you go, whoa, what's all happening here? So I think that, you know, while we talk a lot about the intergenerational impact of trauma, discrimination, and lack of enforcement around what I would say fair housing, it's really important for us to understand that we make that history up as we go. In other words, we're making policy today. We are driving and delivering and continuously reinforcing those disparities just because we remain ignorant of our privilege. We don't understand how to make things better as leaders. We aren't accountable to populations that we can't see and aren't a part of. We do it through a lack of allocation of resources in society that has what I would say financing or revenue flows that just are very inconsistent over time. So, you know, like one of the things that Sam talked about, which is really, you know, we need targeted subsidies for support services for culturally relevant organizations. That needs to be an evergreen source if we're going to actually get ourselves out of this. So, you know, but how many Native people and how many people who actually understand these populations are actually doing policymaking? So there's a leadership gap that we have in Minnesota because who's making policy? Still just people, you know, and so advocacy would help, putting people in leadership positions would help. But you can trace some of this discrimination and you can trace some of this racism through the years. You can also see policy making today and how that's happening. So, you know, for example, we have over the past 4 years, really nationally created a scary narrative around immigrants, especially immigrants of color. We have racialized immigration. The reality is there's still way more immigrants coming from all over the world, different populations, than just immigrants who are of color coming from a certain place. But that will lead to some bias and stereotyping in terms of who gets to be an American in future years. So there's a lot happening that most people really don't, they don't always think about as being tied to housing, but how that expresses itself in the city of Minneapolis or St. Paul is, hey, you look Muslim, I'm not going to rent to you. I'm scared of you. or, you know, you're Black, you must be a criminal, you know, because of the criminalization of poverty we have in this country with our incarceration system.
We're getting a lot of questions from people wondering what they can do to help. You know, they might not be landlords, but, you know, how they can help address this in their own neighborhoods. I wonder if you both might talk about that, but also talk about there's a certain amount of NIMBYism that happens here too, and I wonder how people can kind of advocate for this in their communities.
Well, I think that it really helps when legislators and companies, you know, if you're working in a private firm, when you're developing, when you use your time to actually, if you have been a person who's experienced housing instability or some of what we've been talking about, or you're an ally to this, when you show up to say, hey, housing access and affordability is a really important issue, you know, vote with your presence. That's a really important thing. And it's amazing to me how few people actually do that. They don't go up to the legislature. They don't know who their representatives are. The other thing is you could give to a nonprofit. You could give to Catholic Charities or the Wilder Foundation. You could give to organizations that are helping to support people who are experiencing housing instability. Or you could give to, if housing instability and housing is not your thing and you're a health provider, you know what, go volunteer your time and expertise and go out and do some things. The only thing that I know that we shouldn't do if we actually want to get better together is to just sit back and to know that all these issues exist and to do nothing, to give nothing, no time, no resource, no self-orientation or learning about these issues. But there's a lot, you know, there's also very concrete opportunities like go volunteer for the Wilder research study. You know, the next time it comes around, we need 1,000 people from across the state to help do measurement and administer surveys. Go be a mentor at the church that you're a part of, or to go and do tutoring, you know, at a homeless shelter. I mean, there's a lot of opportunities to engage.
Sam, I wondered if you might just kind of talk about what you're working on in Minneapolis and how, you know, culturally specific solutions to this have worked for you so far.
Definitely. Well, actually, right now we have a housing development that's going to be opening up here in the next month or so, and so that's really encouraging. It's going to be it's called Mina Bima Diziwin. It's means the good life in Ojibwe. It's 110 units right off the Franklin Light Rail Station. And so we're really excited about that. It's going to have a wellness clinic in the ground floor. And so this wellness clinic will help people deal with some of their mental health issues, some of the chemical dependency issues, et cetera. And so, you know, this is all run through the tribe. And so there'll be, you know, Native people and Native providers that are cognizant of some of these historical trauma issues. But one of the most important things with dealing with our Native people is this trust. And so something as simple as saying, hey, you know, I work for Red Lake Nation, you know, that's going to open people up. And so we saw that when we started working with some of the individuals on the Wall of Forgotten Natives, is that these people, you know, people have been trying to reach out to them, trying to work with them, but, you know, this historical trauma had created a level of distrust that was, you know, people couldn't overcome. And so just the process of, and some of these providers are non-Native, you know, it doesn't mean that it only can be Native people, but they work with the tribe. they take the time to educate themselves about the history of Native people. And you know, someone asked, what can we do to be a part of it? It's changing the mentality. And so I believe that each person has a role in that. And I said this once to a group of people, you know, is what can we do to help? It's having those uncomfortable conversations with colleagues. It's having uncomfortable conversations with your legislators, with your family, and really changing the perceptions on Native people, changing the perceptions on homeless people, and becoming an advocate for the truth. And the truth is that when we all succeed in society, we will all do better. And in fact, oppression and racism and prejudice, it's holding back all of us. It's limiting our society. And all of these mentalities of mass incarceration, the limiting of housing, it arises out of our own perceptions on these people. And so you have to be that advocate and really change those perceptions, you know, and so don't be quiet. You know, when you see someone saying, hey, you know, natives, they're good, you know, they have money from casinos or whatever it might be, you know, changing that perception and saying, hey, you know what? In fact, you know, 98% of Native people are some of the most impoverished in the country. You know, in fact, Native people have been, you know, maligned by, you know, these government policies that have been proven, you know, in the academic world to be termination policies that were trying to kill, trying to destroy Native people. You know, we've been fighting for centuries to just survive. And so understanding that trauma and being a helping hand, you know, that's what we can do to really change and shift this. And so we're trying to do that now. We're partnering with many organizations in the Twin Cities, with many landlords, in fact. You know, we have a great group of landlords that are willing to work with us, and you know, they get paid too. You know, it's a financial win for everyone, and it works. You know, some of the hardest hit people, you know, because if you're on the streets and you're living in a tent, it means that you've really been impacted by these issues. Some of the most impacted. We're seeing great success rates because we have culturally appropriate programming and programming that these people can trust, and really that empathy. You know, when you see someone on the street, you know, have that empathy for them. When you see somebody saying something that means to harm those people, you stand up. You know, that's when change happens, when people stand up for what's right and when they stand up for something they believe in. And so we each have a role in that, and not being quiet. You know, I think right now, you know, everyone has a role in changing that. And so we're really excited about the future here. I think we've shown that we've done some financial studies too. We went through and saw that, you know, what is the cost of a homeless person on society? It's immense. You know, the criminal justice system, the hospital system, the emergency room visits, the health disparities it creates in that whole population. You know, the prevalence of hepatitis and other infectious diseases, the cost to society of those, of the transmission of these. It's immense. And all we have to do is convince everyone, our legislators, our people, ourselves, that this little bit of investment is going to change our society. And so we're doing our best. We're participating in, we're working with the Native American Community Clinic in Minneapolis. We've created culturally relevant programming for mental health and chemical dependency issues, and we're seeing great success. We're housing people across the board with our supportive services program, and we're building housing now. And you know, that's the next step, is how do we expand that? Because 110 units, it's, again, the tip of the iceberg. You know, you're not going to solve any kind of housing issues, you know, when you talk about the thousands of people that need to get housed. And so we need home, you know, people that are willing to rent to this population. And we need partners, and we need people that are going to stand up for what's right, and stop the racism, stop the bigotry, and stop all these negative perceptions that are harming all of us. And that's the part that really bothers me, is it's like we're hurting ourselves. Let's stop hurting our own society, and let's uplift our people and create value for all of us. These are so important.
I think that's a great place to end this today. I really appreciate you're both taking the time to talk to us today. I'd like to thank our panelists, Mai-Kao Hong from the Morrison College of Health at the University of St. Thomas, and Sam Strong from the Red Lake Nation. Thank you so much for speaking with us during this hour. We're going to end with another video from Venice Gerald, who we heard from in that video earlier, and she has some advice for people who might be facing instability and uncertainty with their housing.
There's no secret to surviving and preparing oneself for drastic changes. Drastic measures are needed in the event when someone is experiencing, for example, eviction or a change of location. It's important to safeguard your belongings. It's very important to put your belongings in storage, to have a postal office box, and to have a properly working cell phone. When I go to my storage unit, I'll look at my furniture, I look at all the memories of that last household, that last home that I lived in. I think about the last meal that I prepared in that home. I think about the day when the U-Haul truck came. I think about that moment when I walked out that door and locked and secured that place, an empty place. I thought of the idea of securing an empty place and the impact it had on my life at the time, knowing I was moving into a place of uncertainty and a place that is unknown. And please, if you're listening, do not give up. Do not lose hope. Look towards the prospect of a bright future, because life itself is a transition.